Hello, everyone. Good morning. Welcome to day 30 of our Vine Health COVID-19 update. I'm coming to you much later today because I'm having to juggle work and I couldn't get in earlier today. But I thought I have to reach in. We have to continue this conversation and just see how you're all doing. I hope you're all doing well. Today is day 30. We've done it. We're doing it and we're all hanging in there, and I hope you continue to hang in there. The purpose of our updates is to give you the facts and non-fiction of what's been going on in the last 24 hours and to help you survive and thrive during this coronavirus pandemic. So today, there's been a lot of talk about people dying in care homes. So we're going to talk about that quickly and also talk about the fact that Nigeria extended their lockdown. Can you believe that? They actually did extend this lockdown. I am shocked. But what's happened since yesterday? We know what's happened. I hate talking about it. I almost feel like I should stop telling you the increase in death rates. People dying more and more across the world. In England now it's over 11,000. Everybody knows that. We know what the rates are. I want to stop talking about that too much. And if you agree with me, just put that in the box. But I think maybe we should focus on things that would help us improve as well. So I've been having a couple of questions from people. Some of them I've missed, some of them I've tackled. So I'm sorry if I've missed your question. But there's one that I keep getting back. I think there's a lot of anxiety as well going on out there in terms of coronavirus. People are still very anxious about it. And it's very easy to miss the difference between just regular anxiety and when it becomes a really serious sort of a mental illness where we need to check, we need to seek help for. So one of the questions I was getting, someone was talking about having a pain in their throat and whether this could be coronavirus. So I'll talk about that anxiety as well. So why am I shocked about Nigeria's extension of the lockdown? I am shocked by it because the system is so weak. The policies are so weak. The healthcare system is so weak. There's no social welfare. The lives of people have been threatened. So the security risk. So for me, that sort of weak system really, for you to have a total lockdown in a weak system with no help for the people just seems a bit ill-advised, particularly when the number of cases is 343 and has been this way for about 2 months. So clearly we're not having an epidemic in Nigeria, and there are other measures that you could adopt rather than a lockdown. So that's why I'm surprised that extension, it was done. Anyway, so that's what's been happening since yesterday. Death rates are going up, but the number of positive cases are leveling out. So I think there is some hope in the horizon. It will still be a few weeks yet of this lockdown. And in England, we still have at least another 3 weeks of the lockdown to look forward to. So we're not going anywhere yet. We're all going to be here together. Some of us will come to work and some of us will stay home and just make ourselves even better. So yes, in the United States, the picture is much the same. There's a lot of drama in the US, isn't there? There's a lot of drama in the US, and I don't even want to get into the whole Trump whole saga. It's for me, it's just not what we should be discussing right now. We should be thinking about how we're going to make ourselves feel better and how we can be stronger during this time. So that's that. So if there's any more questions that I've missed, please bring it to my attention. Some people are sending me WhatsApp. But I think I have too many social media platforms and somehow things just get missed. I need to streamline my platform so that I can get the questions and only on one side. So I was talking about the whole idea of this people dying in care homes. I'll come back to the question about mental illness because I think that's important that we look at. It's really interesting. We know that the care home deaths are a lot, but they are not counted with the main deaths. There's a rumor going around that people are saying that people have been allowed to die. The truth is, when as medics we look at patients, it sounds cold, but this is what 20, 30 years of training has done to us. We look at the chances of somebody surviving if they were put on ventilation. Now, if their chances of surviving is low, we kind of not encourage, we ask for their opinion about staying home. So unfortunately, over 92 care homes have recorded the COVID-19 pandemic in the United Kingdom, and many of those patients are so vulnerable and they are so frail that it doesn't seem fair to transport them to the hospital for ventilation when we know that they are most likely going to die in hospital. So we keep them at home. But we do a lot of planning. So there's a lot of talking to the families, there's a lot of documentation to see if they agree. But if they say that they want to be taken to the hospital, then we will take them. So that's why there's quite a few care home deaths. But what's important is that PPE must be perfect. Unfortunately, because many of these care homes are run by private owners, sometimes the PPE is not as rigorous as you would expect. So if you work in a care home, you need to make sure that you get your PPE. Don't agree to see somebody who's COVID positive without the appropriate personal protective equipment. So that's what I'll say. And thank you to everyone who's been reaching out to me about PPE, about me staying safe. I really appreciate that. We've got some PPE here. But we're buying our own to make it better, and I constantly wear scrubs now just to make sure that I'm not carrying coronavirus everywhere I go. So that's that. So with the care homes, people are dying in care homes. That's the truth, and they're dying of COVID-19 and of other causes. However, for any health system, you have to manage how people are sent around the system. Okay, in terms of mental illness, there are quite a few people who are very worried about getting coronavirus, and they are worried to the point of, in my honest opinion, where they really need to assess their thinking and maybe speak to somebody to help them. We all get excessive panic about certain things because there's a trigger. So for instance, maybe if you think you're at risk of getting coronavirus, that may be your trigger for you to get very anxious, and then you constantly think that you have it. Now, that may need to be treated. I'll tell you a story. I was consulting in Louth because I work in Louth from time to time. I was consulting in Louth last year, and a gentleman came in and I was seeing him, and he was sure that he had HIV. He felt he had HIV, and he thought he had HIV because he had sexual intercourse with one person that wasn't his regular girlfriend, and that was several years before. And since that time, he was sure that he now had HIV. So he was telling me, he brought up all the tests he had done. He had done several tests from several labs, very convinced, very anxious, and he had been to Louth several times at this point. At that point, I said, look, I felt that he needed to have an anti-anxiety medication, an antidepressant, rather than to continue encouraging him to do all these multiple tests, which we all know are going to be negative. So I use that as an example because sometimes our worrying can cross the line between normal and abnormal, and everybody goes through that, and all of us are on a mental health spectrum. So nobody's accusing anyone of having a mental illness. What I'm saying is that every single person is on a mental health spectrum, and we go from being very well balanced to not being very well balanced. We go from you being able to maintain your emotional well-being to a point where maybe you're suffering from anxiety or depression or schizophrenia or all the myriad of other mental health problems. So the few texts I've received, I'm not able to respond to those texts personally one-on-one because I'm not your doctor, and that would be crossing professional lines. But I can talk about it generally for the benefit of everyone. So I feel that there are some worrying that has crossed the line into being a bit more emotionally unbalanced. And sometimes you might need to get either using things like meditation and mindfulness, yoga, prayer, whatever else you can use, but also actually speaking to your GP and considering getting some medication. If you're constantly 24/7, you get a little tickle in your throat and you think you have COVID-19, you get a little thing going on and you think you have coronavirus going on, that is not normal. So in the community, obviously we don't talk about mental health problems enough, but it is rife in the Black community. Unfortunately, there's a lot of people who are depressed, who are anxious, and who are not just anxious. Being anxious can be normal because it comes and goes. All of these symptoms are when they are present for more than 2 weeks at a time. So if every day over the last 2 weeks you've been feeling sad or feeling low or feeling anxious, then we're able to diagnose a mental health condition. And I can see that it's very rife around us, and we need to be more open about it. So if you're having something like generalized anxiety disorder, there are scores that you can actually score yourself online. There are things that you can do to find out whether you fall into that spectrum or not, or whether you need to have medication or not. But yes, I really want people who are suffering at this time, who are constantly thinking that they've got COVID-19, who are texting me saying that they have this, and it's so heartbreaking because I feel like I can't call you, I can't text you because it's inappropriate. But I can say to you to please call your doctor and speak to them about this overwhelming anxiety, because it's not normal to feel this way. So if you know anybody suffering from a mental health illness, please let us know and speak to them as well. I have a question here. My concern though is that it took the US and many countries over 2 months to begin to record the high level of infection that we're seeing now. Yeah, and absolutely, but there are actually different models that are being practiced. Some countries do a lot of testing. So for instance, if you look at Germany, what they're doing is a lot of testing and their death rates are low. So it's how available are the tests. So yes, but if you look at the US and the UK, we didn't respond with the appropriate measures on time. We're still not having an appropriate number of tests. We're still having very little testing compared to Germany. So if you're going to have a lockdown, it's because you're trying to keep the number of new cases down so that your system can cope with it. But if you're going to have to start out with not really much of a lockdown, then you have things like people wearing masks as they go out. You offer tests to everyone as much as possible. Places like ShopRite, if we have accessibility to testing, then why don't we just put up lots of testing in ShopRite in different places in Lagos? So what would you suggest as an alternative to lockdown being activated in parts of the country? So that's what I'm saying, that there are different models. If you look at countries around the world, they have different models. Some people, like the UK and the United States, that responded very late, had to put in the lockdown because, again, we didn't have accessibility to testing in the UK. The testing was very low, actually. And I think it's only in the last week that we're getting up to about 19,000 tests a day. The tests were not very many, as opposed to Germany that we're doing up to 70,000 tests a day. So if as opposed to having a lockdown in a place like Nigeria where people are suffering and people are waking up in the night and seeing armed robbers in front of their face, then you make testing easily accessible. So more testing and social distancing, and obviously wearing masks. I think people should wear masks everywhere they go in Nigeria, even on a regular day. So it's balancing that. The system is putting people at home without a means of livelihood. I think it's quite tough. I mean, the friends that you have and I have are able to stay home, but that's not the majority of the population. People are suffering and they're hungry. So if coronavirus doesn't kill them, it will be the insecurity and the hunger. I'm just saying that it's not one size fits all for everyone. Every country look at their own model and actually follow what will work for their population. And Ogun State and Lagos, no, it's Ogun State, Abuja and Lagos with the majority of the cases. And I think what should happen is have loads of testing. The private hospitals have not been allowed to test. I'm sure you're aware of that. Which is really, really wrong, particularly in a country where the private sector is the majority of the healthcare that is being offered to most people. Private sector should be able to test people. Tests should be available on, in ShopRite. It should just be widely available, and there should be other things like the masks. I'm not sure about the cost of testing, unfortunately. And we request a test. We don't know how much. I don't know how much it costs. But there and the thing is that there are different types of tests as well. And actually, this is a novel coronavirus, a novel virus. So the tests even now they're getting better each day. Every country is different. You cannot just copy what one country does and do it in your own country. There are other countries that are succeeding at this fight. Belgium, Germany, Denmark. They are doing well. And by the way, all those countries are led by women, just so that I can say that. Not to be sexist, but women seem to be getting something right. I'm just saying that for Nigeria, it doesn't seem like a complete lockdown like this it might be the right thing. And I wonder whether the public health specialists in Nigeria are actually looking at the model that works. We just lift things and we don't then do them properly. But I must say that NCDC is doing their best. Anyway, that's my view. Thank you for really interacting with me today, Soji. I appreciate that, and I like the questions. It's wonderful. But so yeah, I don't really agree with the lockdown in Nigeria. I feel like I don't know how much thought has been given to it. I think it seemed to be the right thing to do, but not taking into context the situation and the condition of the people. It's scary right now. According to my friends that live in Nigeria, they are scared to go out. They're scared. People are hungry and they're desperate. Which on a good day is how it is, but now it's even worse. So yeah. So as I was saying, if you know anybody suffering with a mental health condition, mental health is a massive thing, and I'm really passionate about it because I know that every one of us struggles, every single one of us struggles, and many of us are able to now get a balance, but some people are not. So can you just promise me, if you see this video today, that you just reach out to somebody and just check how they're doing, and just see how their mood is, and if they're struggling in any way, and just share a resource with them. There are millions of resources. If you need any of that, let me know. I'm happy to share different things that I use with you, particularly things like meditation and exercise and all of that. But that's my view. I must go back to work. I'm surprised nobody has not. I just finished my morning surgery, so I shall go now and carry on. Thank you for watching. Please share my videos, share as widely as you can, and I will come back tomorrow and talk about something else. If you have a question, send it to me and try and tag me so that I know that you're asking me rather than me just finding out later. You guys have a great day now. Look after yourselves, look after your mental health, and look after your physical health as well. All right, bye.